It's a new year, a perfect time to start fresh and take steps for a healthier you. But what should be on your health checklist for 2025? Well, today we're talking with Dr. Makiera Simmons-Robinson from Cone Health Burlington Family Practice. So let's get right into it. What is the number one thing that should be on everyone's health checklist this year?
So you want to have your annual physical scheduled. It's new year, fresh, clean slate. Go ahead and do like what you would do for your car, like a nice tune-up kind of check, but for your health. So have your annual physical, get that scheduled. If you have Medicare, getting your annual wellness visit scheduled. And if you do not have a primary care provider, find one ASAP. It's a perfect time to do it. We're all excited to have you and to get you started on a healthy journey for this year.
Okay, so make that schedule, and it could be this month, or it could be February, it could be March or April, whatever it is, but get it scheduled. All right, let's talk about some other health tests or screenings that are recommended based on our age or our risk factors that we should talk with our primary caregiver about.
Yeah. So if you have family history of breast cancer, making sure you're getting scheduled for that mammogram, asking your provider, hey, can you order my mammogram for me? If you have history of prostate cancer, asking for those PSA levels to be drawn with your blood work. It's also good to know, what are my kidney enzymes looking like? What do my liver enzymes look like? What is my potassium, sodium? Getting those metabolic panels, they can be good to have that good baseline to know where you stand. It's also good to know, hey, are my blood counts okay? Am I suffering from anemia? So getting that complete blood cell count is also pretty beneficial in things that I typically order for my annual physicals.
Right, and a lot of those are covered, so you can have the discussion with your doctor about that and ask them questions. So vaccines, also a big part of prevention. How do we make sure that we're up to date? Sometimes, they ask me, when's the last time you got this or got that? And I'm like, I don't remember.
Yeah, exactly. And I think the biggest thing with vaccines is knowing your status. So what vaccines have you had? I know when I was younger, we had the little pink, and girls had pink and guys had blue, the little folder of your vaccine records. And my mom kept that for a long time. But if you don't have that, just asking your provider, hey, is it possible for me to get a copy of my vaccine record? So we're able to see what you've been administered in North Carolina. But if you're coming from a different state, probably getting those records before you transfer to a new provider here in North Carolina would be super helpful. We don't want to double up if we can avoid it. But asking about COVID vaccine, asking about RSV vaccine, asking about the pneumonia vaccine, it is still plenty of time to get your flu vaccine. So please, if you can't get it with your primary care provider, get it at your pharmacy. Especially in this season, we want you protected as much as possible.
Okay, and I'm thinking to myself, the people over 50, the shingles vaccine, right? Because I see that on the commercials all the time. All right.
Absolutely.
So what should be on our health checklist related to exercise and nutrition?
Okay, so a lot of things.
So many things. Where do we start?
But if we want the nice, simple, what is the number, Dr. Robinson, I usually recommend 150 minutes per week. So about 30 minutes, 5 days a week, if you can do that. But I think it's important to remember, if you do a 15-20 minute walk most days a week, I am like, yes, please. And we check that box off. That is getting your body moving. I think it's also important to do movement that you enjoy, that you look forward to doing, so that it's not a chore, but it's also getting that heart rate up. And, as you get older, if you don't use it, you lose it. So I often tell my patients, like, hey, I need you to stay strong. I need those bones to stay strong. Get moving. If that is doing water aerobics, if that is, climbing your stairs, doing commercial breaks while you're watching your favorite program on TV. Anything to get you moving and just not so you're just sitting and being deconditioned. And then as far as nutrition, I think it's easier to add than it is to take away things. So drink more water, eat more vegetables. If you can get half of that plate vegetables, I'm a happy camper.
I love the adding versus the taking away. More water, more veggies.
Yep.
Okay. All right. We're also
Yeah.
going to be talking about mental health, well-being, and we need some steps that should be on the checklist too when it comes to taking care of our mental health. Yes?
Yes, yes, yes. So a couple of things goes there. So I think just prioritizing that time, just some quiet time, if you can do 30 minutes a day, just quiet. Giving yourself the opportunity to reflect, like, did I have a good day? Was today a little more challenging than the day before? Um, Kind of quieting out the voices. We get a lot of chatter, a lot of critique, and going over the things that we did today. So giving yourself that time of reflection, and then doing things that you enjoy, having something planned that you look forward to. So that could kind of check off two things if you're doing something you enjoy that's movement focused. But if it's reading your favorite book, reading a chapter every day, that feeds into that wellness. It makes you happy, it makes you feel better. Um, and then if you notice that things are just getting too much for you, you're feeling more nervous, you're more on edge, you're worried about everything and can't quiet that mind down at night to sleep, then it might not be a bad idea to speak with your provider about it. There are medications, and I am a huge, huge, huge fan of talk therapy. So there is nothing wrong with getting a counselor, therapist, and just having that time to talk.
Let's talk about staying a step ahead of those seasonal related illnesses, colds, flu, all that.
Mm. All right. So I think the number one thing that I would put on that list, getting your flu shot. Get your flu shot. Get the children's flu shot. Everybody get the flu shot. And again, you can get that at your primary care office. You can get that at the pharmacy. Number one thing. We want to try to protect you as best possible from the flu. And then next comes in the COVID vaccines, getting your boosters if you need boosters, the RSV vaccine if you're 60 years and older, and getting your pneumonia vaccine. I don't think a lot of my patients know about this, so they hear about it and they ask me about it, but I am a fan of the pneumonia vaccine as well. And we want to try to prevent you from getting those invasive forms of pneumonia that can cause you to be in the hospital, and we don't want you to have those complications. So staying ahead of it and trying to vaccinate for it is definitely my top priority.
All right, we've talked about exercise, we've talked about eating, we've talked about mental health, we've talked about making sure we make those assignments for our regular visits. Any other items that we haven't talked about yet, but you think should be on our list?
So if you are smoking tobacco, if you're vaping, snuff, dip, any of those things, get that out of the way. That is not a part of the Healthy You 2025 picture. And letting your provider know, hey, I really want to quit these things. And allowing us to help you work towards that goal. That is one of the most powerful things you can do to improve your health, is getting those things out of the picture. So I definitely recommend that one. I tell my patients all the time, it adds no value to your health. So we can get it out of the way. I will cheer you on all the way. Other things I would add is just making sure you are taking your medications that you're prescribed as directed, and understanding why you're on those medications. We want to hear your questions. So bring your questions like, hey, I've been on this for 3 years. Do I need to take this forever? Just having those conversations and just being really clear. It's a good opportunity to do that now at the start of the year. And then I would also say making sure you're seeing your dentist, making sure you're seeing your eye doctor. We have a lot of systems that work together to make us us. So
yeah, it's interesting what the dental hygienist can tell you about the rest of your body, what the eye doctor can tell you about the rest of your body.
Exactly.
All right, a lot of people like to use technology, an app, a wearable device to improve their health. Fine by you?
Oh yeah, I love it. I love when patients come in and they show me their blood pressures. They have these beautiful charts and graphics. I love it. Use it to track your steps. Well, we talked about movement earlier. Track those steps. Let me know. Let me know. 6 months ago you were hitting this target and now you doubled it. I love to hear that. My patients use the devices and apps to track blood sugar. We can use it to just track, like, what were your levels for your cholesterol, for example, last year versus this year. Some devices will tell you if your heart rate's too high. They'll monitor blood pressure for you. So, oh yeah, I love the technology and I love the reports that my patients are able to bring in, and we can make really good decisions based off of that data.
Okay, we have just under a minute. For someone just starting to prioritize their health, what's one thing they can check off today?
Today, getting that PCP, investing in a blood pressure monitor if you don't have one already, and yeah, I'll give you those. I give
Okay,
you those.
yep. We got to start small, right? So that we don't
Yeah.
feel like we're overwhelmed. So we
Right.
appreciate that. Thank you for helping us get on track and taking a look at that checklist. If you want maybe a family member, another loved one, to hear what she had to say, you can always find this interview in the To Your Well-Being section of our website.